I also want to assure you that as chairman of both this Appropriations Subcommittee and the Authorizing Committee, the Health Committee, your department will continue to receive the resources you need to implement the Affordable Care Act. The American people will not allow the hard-earned protections and benefits in this law to be taken away, and neither will we. I am well aware that some opponents of health care reform say they intend to use the Labor HHS Appropriations Bill, our bill, as a vehicle for defunding the Affordable Care Act. That will not happen.
The 2012 bill includes $4.2 billion in mandatory spending for the Affordable Health Care Act, ACA. This is $4.2 billion that, due to Senate rules, this subcommittee cannot reduce or rescind. It is simply more spending for another entitlement program. Secretary Sebelius, we fundamentally disagree on the implementation of the ACA. However, one area of the ACA we should agree on is that $38 million to fund one website is unacceptable, a lot of money. Further, I'm concerned that many important programs, such as the Community Health Center Fund, are moved to the mandatory side of the ledger and funded under the ACA. The question is, what happens if the ACA is repealed and agencies' baseline funding levels are too low to cover the cost of these programs?
Thanks to the new law, children are no longer denied coverage because of their pre-existing health conditions. Families have new protections under the Patient's Bill of Rights. Businesses are beginning to get some relief from soaring health care costs, and seniors have lower cost access to prescription drugs and preventive care. We're building on this first year's progress by supporting innovative new models of care that will improve patient safety and quality while reducing the burden of rising health costs on families, businesses, cities, and states.